Hi everybody, my name is Carrie, and if you're watching this video, there's a good chance that maybe you know me already, so you won't have a whole lot of questions as to why I'm making this video, because you'll already know, because you're just lucky like that, and you just happen to be one of my very, very beautiful friends. But I want to start the whole video by saying, or maybe this might have to be in a couple of videos, but I'm going to start by saying that I do not in any way, shape, or form work for Horizon Pharmaceuticals or represent what they might want me to say. I'm saying all this on my own accord. I am saying it after a very informed and probably privileged conversation with two of their senior communications people. They just happen to be extremely good in communications, as am I, and they are also extremely interested in individuals' rights to privacy, as am I. So I am putting it on YouTube for a couple of reasons. Number one is because I am trying to locate a certain demographic of people who might fall under a certain group of people, which is what a demographic is. And secondly, because I am not getting any type of reimbursement of any kind. It's all a volunteer basis. I am going to shamelessly plug an expensive hobby of mine that I have not made a dime on, even though I've got a website for it and everything. So it's called carriesclovers.com. And this is the only thing you're going to have to watch that's like shameless plugging of products, right? All my life, when I was younger, especially, I could walk right by a 4-leaf clover, see it, have to turn around and go back and pick it. And I literally have thousands of clovers saved in a binder. So I started making stuff with them. And as you might guess, these things start costing money, you know, like really cool things. So they start costing money over time, like when you want to collect every sort of material known to man, that you can make really, really cool stuff for clovers. But actually, some of my favorite things, oh, here's a cute box, like a heart box. Some of my very favorite things were inspired by two of the most beautiful people that ever, you know, walked the face of the earth, in my mind, especially. But they were my two daughters who have gone to heaven ahead of me as adults. So I started making things that were both lucky and cherished. So I started making these little guys, which are 4-leaf clovers combined with my loved one's ashes. And I also started making like meditation stones, and I use like the hair of my daughter that was not cremated, and I did that in a rose quartz meditation stone that I don't have right here because I use it so much that I probably left it elsewhere. But anyway, those are the shameless plugging that I'm gonna do, and that's the end of that. Thank you for humoring me. I feel a nice cool breeze on me right now. But anyhow, so now it's time to get into the nitty-gritty of what this video or videos are going to be about, and that is the fact that I have been chatting up some people at Horizon Pharmaceuticals, and they have some answers that I think a lot of people are wondering about and they're wanting to know. I happen to suffer from and get treated for, have been treated for the disease Graves' ophthalmopathy. I think it's also called Graves' eye disease. It's called thyroid eye disease. It's called a whole bunch of different things, but it's all the same thing, and that is the body's inability to know that your eye tissue, the fatty and the muscles of your eyes, are not an enemy. That's what it boils down to. It is related to the thyroid. I was told that it basically means that your thyroid tissue is so similar to your eye tissue that it happens for some people that get Graves' disease, which is a thyroid related autoimmune disease. There's no cure. The thyroid, they can radiate, they can take it out, they can do all kinds of things, but they can't take your eyes out. They can't radiate. Well, actually, they do radiate the eyes as one treatment. However, there is only just so much they can do. So before this certain drug came out, it's called Tepezza, and it's also known as teprotumumab, and I believe that I am pronouncing that really wrong, but I apologize, and hopefully that helps you guys to understand that I really don't work for Horizon. I'm just trying to help some very, very beautiful friends of mine. So, basically, I'm gathering some answers by some really worried people. They have either gone through or they've begun the process, or they have been approved for the process of receiving this drug, which originally was used to try to combat cancer. However, it was proven ineffective, and sort of like Viagra used to be a blood pressure medication, and now it's just a form of mahogany. This medication was begun as a cancer treatment, and it is now a biotherapy in the treatment of thyroid eye disease. Kind of makes me wonder if it helps with thyroid disease also. I guess I'll have to ask them that when I talk to them again. So anyhow, this is all the stuff that you never wanted to know about the forced, mandated FDA slow down of the manufacturing of this drug. Okay. So from what I've found out, the one thing that I think that you guys need to understand, if you have been approved or you've started the medication, see, this is what happens when you have these surgeries to break your eye sockets. My treatments came along before this medication did, obviously. So anyhow, they know you're upset. All right, if you're their patient or you are a patient, they know you're mad. And if you were one of the unfortunate people that had your very first treatment and a ray of hope in this absolutely devastating disease, if you had one treatment and 2 days later they said, hey, guess what? The FDA is really raining on the parade, and we are being forced to cease the manufacture of this drug and start making the Covid19 vaccine based on the Operation Warp Speed. basically what they want you to know is, yes, they do want you to stay in contact with your, what they call P.A.M, which is personal advocate. I don't even know what it stands for. I forgot. I knew, but I forgot. It's your P.A.M. I'm going to refer to them as your P.A.M. So it's your personal advocate for the medication. That's probably what it is. So they do want you to stay in contact with your P.A.M. Your P.A.M. this evening is in a meeting with them tonight to talk about the latest and greatest news. They are getting updated, and they're being news flashed based on some very helpful people. But they're getting updated tonight about what is something that they should know going on in the patient land. So they're getting some new information tonight. They're being updated on some of the concerns that people are having. And I'm here to just sort of play as a go-between in the fact that I sort of have a relationship with both patients, and I reached out to the people of Horizon. Quite frankly, this whole medication was a thorn in my side, and yeah, I won't go into that, but I'm glad it's here. It's sort of like that baby that took you a while to get used to the idea that you were going to have. Like, okay, I'm pregnant, you know. But then once you get used to the idea and you realize that it's a blessing, you sort of go, oh, okay, all right, it's a baby. You know, it's a really sweet, yummy smelling baby. So anyhow, it's, you know, it's a lot of this is uncharted territory. So you got to understand that as frustrated as you are, they are pretty frustrated too. And their biggest message for you is that the only people in complete control over the manufacturing of their medication that they have paid a lot of money to have developed, and you have paid or had an insurance company agree to pay an unbelievable amount to have the treatment, is that the only people in charge of the production of this medication is the FDA. The only country that it's been approved in is the United States of America. And it was fast-tracked because of people like us who have this disease, are freaked out about it. And, you know, we're just so excited over the thought of a medication that could manage the devastating way that it rules our lives, right? But the thing is that okay, so I'm going to explain it to you the way that I sort of coined with them. It's kind of like if you're a woman, which chances are if you're watching this, you might be, because it's more on women than men, or more women have this than men. But if you can imagine that, you know, a lot of these posh hair salons, they rent their chairs to stylists that have a following, right? So stylists will pay rent for a chair in a posh salon that has a name for itself. They have a name for themselves, and it's a perfect little match, right? So Horizon Pharmaceuticals rents space in a posh salon slash pharmaceutical company that manufactures drugs right here in the state I live in, which is Indiana. And the way that he helped to bring that full circle is to say, okay, say that we rent 4 chairs in that posh salon. Well, the FDA, with warp speed and the desperate need for a vaccine for COVID-19, came in and said, sorry, but, we're going to have to take 3 of your 4 chairs. And on top of that, unfortunately, the FDA is also in charge. Like, you would think that Horizon would go, hey, like, so then we'll just speed up the 4th chair. We'll, turn over 10 times the clients that we were. We'll kick them out quick, Don't give them the luxury service that they're used to. But even that, apparently they have no control over. They can't speed up the medication the way or how fast they make it without FDA approval. So it all has to go through FDA. So what you need to know is that contacting them is important, and they do need, like, your P.A.M. needs to stay in contact with you. It's very important that you stay in contact with both your doctor and your P.A.M., even though I know and I've made them very aware that you are being bounced back and forth like a little ping pong ball. Like, oh, well, maybe you need to talk to the drug rep. And then the drug rep says, oh, you've got to talk to your doctor. And they just keep bouncing you back and forth, right? Well, so let's just, say that hopefully your P.A.M. will have more information, or they'll be more enlightened anyway after a meeting they're having tonight. And doctors, quite frankly, this is all uncharted territory, because when you have an effective treatment that goes through a clinical trial and then gets fast-tracked to treat an illness, who's going to say, hey, please stop my treatment so that you can research what happens when it's stopped and then restarted months and months later? I wouldn't. I wouldn't want them. I'd be like, this is working. Like, you better just keep on giving it to me, because I am not going to deal with no way would I let them stop voluntarily, just to see how well it went, down the road if they picked it up later. Or, so I hope that helps a little bit with your understanding of why they don't have this information, because this is all uncharted territory. And the people listening to this, you're the pioneers. You're blazing this trail. And if anything, you're sort of involuntarily giving generations to come the data that they need to be able to tell their patients, like, this is what's going to happen if you stop and decide to pick it up later. Or this is what's going to happen if you stop showing up to your appointments. Or if you can't afford your co-payments, or whatever reason someone would stop. Okay. Now I'm going to pat myself on the back here, because I was like, okay, well, were there any patients who had to discontinue using the medication because they couldn't tolerate the side effects? And he kind of went, yeah, there were some patients that couldn't tolerate side effects. And that's not a bad idea. So that's who I'm looking for. We're looking for you. Did you start on this treatment and not continue because you couldn't handle the side effects. That is the exact people that we're looking for. One thing I can assure you about is that there was no, let's see, there was no evidence. Let's see. I'm going to start the new video with the information I'm about to give you. So let me have a second to look it up. I'm going to upload this one and then start another video. So I don't know how many parts it'll have to go into, but chances are this one's going to be cut into a couple of pieces. So I will be back. Stay tuned.